In our Health Watch report, a tiny fingertip device could serve as an early warning sign of COVID-19 pneumonia. Local 3's Connie Fellman has more.
Many patients who contract COVID-19 developed pneumonia, and in some cases, patients don't realize they have it until it's very hard for them to catch their breath. But there's a new device that can help patients monitor their oxygen levels at home so they can have an early warning if their lungs aren't working quite right.
For Brad Weaver and his 18-year-old daughter Emma, COVID-19 means they have to be extra vigilant. Since Emma can't tell her dad if she's not feeling well, Brad takes her temperature under her arm, and he uses this to monitor Emma's blood oxygen levels. The pulse oximeter can detect even small changes in the way lungs move oxygen to the rest of the body. Emergency medicine physician Richard Levitan volunteered on the COVID front lines, helping former colleagues at Bellevue Hospital. He was shocked when he assessed some patients coming in the ER. Dr. Levitan recommends using pulse oximeters at home, especially if patients are high risk. He says watching for low oxygen levels could help people recognize the early signs of COVID pneumonia. It's not a cure for COVID, but it gives families like the Weavers a little peace of mind.
Pulse oximeters are available over the counter at most drugstores, ranging in cost from about $40 to about $70. A level considered normal is 94 or above. Dr. Levitan says most hospitals won't release patients who register under 92. So if your levels are that low, it might be a signal that your lungs aren't working efficiently. And that's your Health Watch. I'm Connie Fellman, Local 3 News.